Overview of Osce exam. So, you're probably wondering what the Osce test will look and feel like. There are different Osce centres around the UK, but the Osce format is identical in each. The exam will take place in a mock hospital ward environment. In turn, you will rotate around different clinical stations where you will be assessed on your nursing competencies. Your examiner will present you with different clinical scenarios at each ward bay, and you will need to respond appropriately. Afterwards, you will be asked to perform some standard clinical procedures and also demonstrate. There will be 10 Osce stations in total. Over 4 stations, you will be asked to assess, plan, implement, and then evaluate the care of a patient. This will be the same patient for all 4 stations. 4 other stations will test some standard clinical skills. You will be given 2 pairs of 2 skills to perform and marked against standard marking criteria. There are a further 2 stations, one which is designed to assess nursing values and behaviours, and the other to assess evidence-based practice. The exam is pass or fail, but if you only fail one station, then you only have to resit that one station again. The key challenge in the exam is managing your time. Just as in real life, you can't solve all patients' problems at once. Our top tip is to acknowledge and identify these problems so you don't try to solve all of them in one go, just the ones you can. If you want to see more details about what the test is like, we have provided some helpful links in the resources section. We have also included links to downloadable examples of all the paperwork that is used in the Osce. Please bear in mind that these forms can differ slightly across different organisations, but the principles are the same, so please use the paperwork as a guide of what to expect only. Remember, once you are registered for an Osce, you will have access to the university's electronic platform regarding Osce grids and Osce exam tips, so be sure to review these resources as soon as you can. Before commencing the Osce, your examiner will usually give you the opportunity to orient yourself with the station and ask any questions you might have. We recommend that you use this time to familiarize yourself with the environment and check the following: where the clinical waste bin and sharps bin is located, where the drug expiry date is shown on the medication packaging, that the machines are properly charged, that you know how to operate the equipment, and that you know how to open the drug trolley with your key. If you make a mistake in the Osce, try to verbalize it as soon as possible to your assessor so they know you are aware of your error. For example, if you forget to ask the patient to uncross their legs before taking their blood pressure, you can verbalize this and ask the examiner if they are happy for you to proceed. They may indicate that you can proceed, but if they tell you to do what you would do in practice, this means you need to correct your mistake. In this case, that would mean redoing those observations. If you have run out of time at your station, you can also verbalize to your examiner what you would have done if you had not run out of time. For example, you could say, "If I had more time, I would ask the patient more about their diet because I could see crisps on their bedside table, but I didn't have time to ask them about it." Okay, let's dive in.